afternoon, my name is Carla Nelson and I am a Level 2 Allied Healthcare student at the Kettering Baptist Center. Today I will be demonstrating the care of a bedridden diabetic patient, and I also will be conducting a GMR test on the patient along with a skincare assessment. Walk with me as I walk you through the procedure. Can I come? Good morning.
Good morning.
My name is Nurse Carla Nelson and I will be your assistant for today, and I will be here to carry out your skin assessment and a GMR testing on you.
Okay.
Are you in agreement with that?
Yes.
Okay. Please bear in mind that the test that will be carried out on you requires me to touch your body parts, certain parts of your body. Are you in agreement with that?
Yes.
Okay, thank you. Before we begin, I'm going to ask you a little question. Could you state your full name?
Kira.
And how old are you?
15.
Okay, thank you. All right, I'm going to do the hand washing technique and I'll be right back to start the procedure on you. All right? Hand washing technique, get a little soap, turn on the pipe, a little water on my hands, wash between my hands, fingers. Turn up my hand is thoroughly clean. Rinse my hand off. Take the hand towel, turn the pipe off. Dispose of the hand towel. Just dry my hand. Alright, good afternoon again, Ms. Bailey. All COVID-19 protocols must be observed. How are you feeling today, Ms. Bailey?
I'm feeling fine.
You're feeling fine. Alright, I'm going to begin with your head. I'm going to check your hair to see if there's any cuts or any scrapes or anything that is suspicious. Alright, I've checked. Everything seems to be fine. Alright, I am going to ask you to remove your mask and I'm going to check into your mouth to see if any swelling or anything that is happening that I must be aware of. Thank you. Open wide, please. Okay, tongue is fine. Teeth seem to be fine. There's no cavity and there's no swelling. For the past couple of days, up to this morning, you have not had any bleeding coming from your mouth, right?
Yeah.
You have had been bleeding? Okay. You can put up back your mask. Thank you very much. Let me check behind your ears to see if there's any swelling in your ears, to see if there's any wax that is built up of concern. No swelling, no wax. Let me see if the other ears. Let me see. Okay, there's nothing. It's fine. Let me check your eyes to see if there's any redness or if there's any discoloration that is of concern. No, you're fine. Alright, let me check under your neck to see if there's any swelling or any discoloration. Okay, seem to be fine. Alright, let me check your arm. Check under your arm, seem to be fine. Check under your arm, seem to be fine. Check your elbow, no discoloration, no bruises. Check the other elbow to see if there's anything. Seem to be fine. Let me check your fingernails to see if there's any discoloration or any sores between your fingers. Seem to be fine. This hand seems to be fine. Alright? I am going to ask you to, I'm going to assist you in moving to the side to check to see. Before I move you, I'm going to use my sheet to cover you so I can check. Move down the sheet. Alright. Push it to the side. Okay. Alright. Check to see if there is any sores or anything on your skin. Okay, seem to be fine. Okay. on by checking your foot. Let's see if there's any sores. Foot is fine, no swelling, no sores. Foot seems to be fine. Alright, so everything seems to be fine, Miss Bailey. Alright? I am going to continue, stop the video, and washing technique, get a little soap, turn on the pipe, a little water on my hands, wash between my hands, fingers. Turn up my hand is thoroughly clean. Rinse my hand off. Take the hand towel, turn the pipe off. Dispose of the hand towel. Show you. Drip dry my hand. Yes, Miss Bailey, I am back. I am going to test your sugar level now. I'm going to do the GMR testing on you. Putting my strip into my machine. I am going to prick your finger. It may feel a little pain, but I am going to prick the side of your finger where you have more veins. Alright, blood veins.
Okay.
Which of the fingers do you prefer me to stick?
This one.
Which one? Could you show me which one?
Yeah.
This finger?
Yes.
Could you turn it here? May feel a little pain. Okay. So Miss Bailey, your results show. I'm going to put a piece of pressure on your finger to stop the bleeding. Put it on. Let me see what your reading says. Your reading says 7.8. So it's perfectly fine to say that your blood sugar level is fine. So apply pressure on it. Alright? I'm going to dispose of the tape, the strip. Alright? And please bear in mind that your blood sugar level must continue to be maintained. It's perfectly fine now, so whatever you're doing, continue it. Maintain a balanced diet that is expected of you.
Okay.
And eat in the time that is specified, alright? I'll dispose it in a piece of tissue. I'm going to throw it in the bin, in the bathroom, alright?